Good morning, good afternoon, good evening, everybody. Welcome to the Global Digital Health Network's November 2021 monthly meeting. We're just going to give everyone another minute or two to join, and then we will get started. In the meantime, please feel free to introduce yourself in the chat. We'd love to hear where people are joining us from. Welcome, everybody. We're just going to give everyone one more minute to join. If you're just joining us, please do feel free to introduce yourself in the chat, and we'll begin momentarily. All right, we're going to get started because I know we have a packed agenda today. Good morning, good afternoon, good evening, everybody. My name is Christina Villela, and I'm co-chair, one of the co-chairs of the Global Digital Health Network. And I wanted to welcome you all to our November monthly meeting focused on distance and blended learning, and specifically looking at pivoting from in-person and virtual trainings for frontline health workers. I know that this is an incredibly hot topic, as it has been over the past 20 plus months of the pandemic, and will continue to be as we move forward. So I'm really grateful to Abt Associates for hosting this meeting on this really important topic, and to all our speakers for being here today to share their experiences. Before we get started with our content, I did want to just give a few housekeeping updates. Mainly that the Global Digital Health Forum is happening in less than 3 weeks, December 6th through the 8th. It is an entirely virtual event, but with the same wonderful content as we have always had. Registration is open, and regular registration is open through next Friday, November 26th. So please do register now if you have not done so already. I'm hoping one of my colleagues can put that bit.ly in the chat so that you all can easily access registration. And I'm going to turn it over to Sarah Romarini, who is the Global Digital Health Lead at Abt Associates, who is going to be hosting and moderating today's session. So Sarah, without further ado, over to you.
Great. Thanks, Christina. And welcome to our November Global Digital Health Network meeting. As Christina mentioned, I'm Sarah Romarini, the Global Digital Health Lead on Abt Associates' digital delivery team. We're looking forward to this discussion. As Christina mentioned, I'm personally looking forward to this discussion of whether or not we're all Zoomed. And maybe that's a good thing. This topic about pivoting from in-person to virtual trainings and distance learning, this has really been on our collective community's minds for a while, like before COVID, but it's especially been on the forefront in the last year or so. And I think one of the things that I'm looking forward to today is, there's some great new resources that you'll learn about to help navigate this. And then also, this is kind of like where our hive mind is. This is really just like where it shines. This is a community, and this is an amazing resource. And we look forward to the discussion and your experiences, those of the panelists, and then also as our collective community. We have some powerful lessons learned over the last year in what it takes to virtually train frontline workers with distance and blended learning, especially for those who might not be used to being trained virtually, or for those of whom, we have the additional opportunity where introducing digital applications or digital tools, this might be a behavior change in their workflow. So we have some really great panelists joining us today to share their insights. Victoria Neff is the Assistant Director at EdTech Center, World Education. That's a Momentum partner. And she's also the co-author on the hot off the press two-part series on distance and blended learning. And so she'll share a little bit about that to frame our discussion. And then next, my colleague, Yulia Rakhmova will join us from Abt Associates. This is Tajikistan Healthy Mother, Healthy Baby activity. She's the digital health specialist and has done an amazing job of leading the rollout of their many digital tools. And she'll share about their blended learning approach that included virtual trainings and some adaptations and pivots and lessons learned along the way, as well as kind of that process of gaining trust. After Walter Vink, Dimagi's Deputy Director of Program Delivery, they're also a partner with us on Tajikistan's Healthy Mother, Healthy Baby activity, who will share on their practical experiences training district health officers and MOH teams, not in Tajikistan, but in Malawi, and also pointing to their broader experience. And then lastly, Caroline Fuller from Viamo will share on the digital engagement process for learning, and will share about Viamo's experiences in Rwanda. That said, we are really keen to have your comments and experiences. Please share those in the chat, and then we'll also have time for Q&A at the end. So let's kind of pretend that we're proverbially in a room with each other and just can have those, those candid conversations. So with that, I'm going to pivot to a little poll, and if we can put that up, that would be great. Just to see if this is something that you all have experienced personally, or as an organization, is this something that where we are? So we have two questions. One, have you pivoted from in-person to virtual trainings or distance learning? And then secondly, what has been your greatest challenge? So please, the second one is hopefully select as many answers as you want. We want to hear about your challenges. We'll give a minute for that. Thank you everyone for filling those out. Please keep those coming. That will also help all of us kind of tailor our conversation to make sure that we're hitting on those points. Great. And unsurprisingly, many of you are pivoting from in-person to virtual trainings or blended approaches, or you're in the process of this. So again, pointing, this is quite timely. And then also I love to see kind of how these bars are changing, for your challenges. We're seeing a lot, all of these seem to be very relevant, especially just with the process. It looks like interacting with learners, engaging is really coming out, also keeping that motivation up. That can be hard, as I think many of you have felt. It's hard to be on hours and hours of digital or kind of virtual platforms. The digital literacy that's going to definitely come out, and kind of making sure that we help users overcome that, connectivity issues, of course. Excellent, great. Well, we have some really great fuel for today's conversation. And with that segues really nicely into Victoria's presentation. So Victoria, take it away.
Great, I'm just going to start screen sharing. Give me a second. Okay, great. Wonderful. Thank you so much. I'm so thrilled to be here. I'm Victoria Neff, the Assistant Director of the EdTech Center at World Education. And yes, so thrilled to be here to share more about our work collaborating with USAID's Momentum Initiative, and specifically the Getting Started with Distance and Blended Learning Guides, which is an open resource you and your programs can start using right away to inform your digital learning strategies and implementation. A little bit about World Education before we get started. We're an international nonprofit. We've worked in over 50 countries since 1951, and for 70 years, our work has been driven by the belief that education is a powerful tool to improve quality of life, health outcomes, and increase economic opportunities. And our EdTech Center shares that belief, and we seek to advance digital equity and digital resilience to enable everyone to thrive as learners, workers, family members, and community members. So I want to start our discussion today framing our work and providing some more context for the resources that I'm going to share. I'm sure many of you have experienced the call to distance learning in the past year and a half. As the poll shows, we're all in the process of or have made the transition to digital learning strategies and implementation. And so we've seen this in the past year and a half, and our dependence on digital technologies has certainly accelerated since the onset of the pandemic, as many things have shifted to online or digital formats. In terms of some of the trends, global connectivity has doubled since 2014, and more than ever, people around the world are relying on digital technologies, increasingly their phones, for daily life tasks. So the investments in global connectivity and digital infrastructure that we're seeing, coupled with the advancements in digital technology capabilities, so that's usability of digital tools, the accessibility, the affordability, has led to this pace of digital transformation worldwide, which is just unprecedented. So what we're seeing is that everyone needs technology and digital skills to participate meaningfully. Yet we also know that the need to use technology in daily life, whether it be to learn or to work, can create barriers for those who lack access. And so access could be many things. Access could be the device or internet access. It could also be the lack of digital literacy skills and lack of digital problem-solving skills to navigate online opportunities. So we see this digital divide in our work, this tension between the pace of digital transformations and some of these access barriers. And so our discussion today really centers on how we can enhance our capacity building work in health systems, leveraging digital tools and solutions, while also adopting these integrated approaches to supporting digital skills development, access, and inclusion. So enter the collaboration with USAID's Momentum Initiative. The Momentum Initiative is a set of innovative awards funded by USAID to improve maternal, newborn, and child health services, voluntary family planning, reproductive health care in partner countries around the world. And so as programs look to transition to remote training and services, we developed these two guides to support Momentum programs and partners in their work to strengthen the capacity and resilience of local institutions and groups to provide high quality healthcare. So these are two guides that build off of each other. The first one is really focused on providing the framework and tools needed to help you plan and strategize on your distance and blended learning strategies. And the second one builds off of that and really is about taking that plan and putting it into action and providing some guidance, step-by-step guidance and resources implementing a distance or blended learning program. So I just want to say a little bit more about how these guides were developed, and then we're going to take a peek and go in. There's a QR code right here. Like I said, these guides are freely available. If you have your phone, you can scan that QR code, and that will take you to the page. I'll also put the link in the chat at some point, so you all have access to that. So as I mentioned, the USAID's Momentum Initiative just funded the development of these guides, and the process for how they were developed was very inclusive process, working with many of the partners, all of the partners within the digital health technical group. And so just to give you guys a really quick review of how this resource came about, we did a very robust literature review and landscape scan. We also surveyed many of you through the listserv, and got some really great feedback on what innovations you were doing in your work, and different projects, pilots. So thank you all for sharing. We definitely looked to you for some of those examples and promising practices that we wanted to feature. And then we also had deep dives with projects and teams to kind of further uncover what some of those strategies and resources were that were being used. And then putting together, building off of those, and again, creating these really comprehensive guides that provide step-by-step guidance, resources, and tools. I will also want to say that we are also on the link to where you can get the guides. There's also a link for feedback. So if you think that there's something missing, or you want to or you have a suggestion for how to improve the guides, we're all ears. So please continue to share your feedback with us. So what is in the guides? The first guide, part 1, as I said, provides a really great framework and step-by-step guidance for planning your distance and blended learning program. A lot of that's focused on assessing your organization's capacity. Sometimes we think about, okay, what are the needs of our training participants, of the communities we're trying to serve? But it's also very important to assess your organization's capacity and what are the gaps. So we have a technology inventory tool to help organizations think through that and strategize. We also have different digital literacy, digital skills assessment tools that can be used for instructors to assess their digital literacy skills. It can be used for participants. So there's a bunch of tools for that. And then within the guide, there's also a list of distance learning health resources and courses. The second guide, as I said, builds off of this and really focuses on the implementation of your distance and blended learning program. So what are the tools that you're going to be using to deliver instruction, to communicate with participants, to assess, and what are those strategies for using the tools? So we have criteria checklist for selecting training tools, basically like the different considerations and things that you should be looking for. And then we also have communication strategy and planning tool. And then within the assessment and evaluation section, we have some sample strategies and tools that you can use. So let's take a peek really quickly. I know that one thing that came up in the poll was engagement. I think that was actually one of the highest challenges that programs were facing, your programs were facing. So I'm just going to pull up the guide here. In the second guide, there is a section on maximizing engagement. There's actually a full section on adapting face-to-face training for distance blended learning remote delivery. And so this is on page 23. And in this section here, there is a guidance on how to maximize access and maximize engagement, and the different things that you should be thinking about as you are looking to offer, maybe like mobile learning or mobile access, how you're modularizing the content, how you're, spacing that, and what are some of the ways that you can support engagement and retention. So I know that I'm almost out of time. I'm excited to have some more discussion around the needs that you're seeing in your work, and share a little bit more about this resource, and again, like, have a discussion with you all. This is my contact information if you have any questions. Also, feel free to put them in the chat. I'll be responding to them throughout. So I am going to turn it back to the team. Thank you all so much.
Thanks, Victoria. Really exciting stuff. And I think, for our team too, I just remember sharing these resources, and it was just like, oh my goodness, we are so glad that these exist. And, looking forward to, again, this is like the hive mind, hearing how the rest of the community is using these and how we can all learn lessons from each other.
Absolutely.
And we will be, this has come up, we will be sharing slides, including links after this, after the meeting. So please stay tuned. We're going to pivot a little bit to putting theory into practice. And I'm going to bring my colleague Yulia from the Healthy Mother, Healthy Baby project in Tajikistan to share a little bit about their experiences. Over to you, Yulia.
Thank you, Sarah. Hello, my name is Yulia, and I'm working at HMHB project of Abt Associates. And
Yulia, you're muted.
Oh, I'm sorry. Hello, my name is Yulia, and I'm working at HMHB project, Healthy Mother, Healthy Baby activity of Abt Associates. And the goal of the HMHB is to improve the quality and services of maternal, newborn, and child health and nutrition in Tajikistan. To deliver long-term country results, HMHB collaborates with the Ministry of Health to adopt emancipation nutrition systems and interventions to strengthen local technical and organizational capacities to improve quality. During the first year of our project, several digital data collection tools were developed by Dimagi, and there is a lot of interesting applications such as rapid health facility assessment application of continuous medical education, continuous based events, digital application, and knowledge, attitude, and practice survey app. All those applications are designed for data collection. After that, the data is transferred to the DHIS system, which allows data analysis. This is HMHB digital framework, which was designed to help accelerate the project's overall goal. During the proposal stage, we developed a digital strategy that was intertwined with our operation management and reporting. Below is the technical, and we have 4 target audience who benefit from HMHB's digital tools. This is a quick overview, and if it will, please connect me after if you have any questions. There are individuals to our target audience, workforce development with the Ministry of Health, community interventions, and our work with the national government and Khatlon region government. Below that, we have robust data exchange among those difficult levels in the DHIS for improved analysis and target operations. Below that is our audience to USAID and Tajikistan data security. Far right, we have digital transformation that's happening throughout the organization. I will tell you a little bit about rapid health facility assessment workflow. This diagram illustrated our RHFA processes and how data moves from tables during the RHFA assessment into dashboards and scorecards. RHFA data collection happens digitally on site using tablets. We configured ComCare and open source software. We have 2 levels of data quality checks plus validation rules during data entry. All 2,200 scores are pushed to Abt monitoring and evaluation software, which is based on DHIS2. DHIS2 is another open source software for visualization and analysis data. Scorecards and charts are automatically updated and shared with MOH stakeholders. Okay, but we had to teach people how to use these tools. For example, 24 national consultants used the RHFA application. They had no technical education and no trust in digital tools. After all, they're used to keeping records on paper. But how do you make people understand that digital tools can and should be used? How to teach to use and show clearly that those tools have several advantages. For example, they greatly save time, effort, and give more results while minimizing the risk of data loss. They execute of human factor because a properly configured computer will not be mistaken when calculating the results, unlike a tired person. So what was the challenge of this situation? We have to show people that data can be collected on digital devices, and this was done in practice. That the data is stored in a secure place and can be accessed from anywhere in the world. And that this system simplifies the process of data analysis, and that this data will be reliable, protected if necessary. Backups can be made much easier and faster than using paper versions. So we understood why we are doing this. Now let's revolve how we did it. Our team used a blended learning system for our consultants. The trainings were held for 3 days, and after that, after these days were online sessions in Skype and Zoom. At the trainings, our team personally presented the tools of our data management system and showed how to use, helped each participant to master them directly in practice, because practice is very important to consolidate knowledge. At the online sessions, we refreshed memory a little, and the 3 days training we had completed, and deliver into a new features of the application, as well as talking about the possibility of updating them and answering all the questions. Thus, we have reduced the time for conducting the RHFA from 6 months to 1. Now, our trained specialists are using our application to collect data and upload the collection information to DHIS2 for future analysis. We live in digital age. Let's put them in our lives and let them facilitate such important processes as data collection. Thank you. Please let me know if you have any questions.
Great. Thanks so much, Julia. And I think, this was a really interesting experience just of, Healthy Mother, Healthy Baby was launched during COVID in the thick of it, and it's still affecting, Tajikistan now. And that was really an experience of not only introducing blended approaches, but also navigating through some of those connectivity issues, the digital literacy, getting the buy-in, many of those issues that that this collective community was pointing to in the poll. So you mentioned ComCare, which was very much used in the Healthy Mother, Healthy Baby project. And that helps us to pivot nicely to Walter, who will share about Dimagi's experience in Malawi. And just a quick note for our panelists on time. We want to make sure that we have time for Q&A. So we will encourage you to stick to the time. So thank you very much. Over to you, Walter.
Great, thank you. I'll try and stick to the time. So I'll be talking to the following 3 things quickly on pivoting to remote trainings, remote training of trainers, and then remote end user training that we piloted in a couple of places. So pivoting to remote training, COVID-19 has caused many of us to change the way we live and work, and due to the pandemic, Dimagi also had to shift to a fully remote project execution approach to ensure that we continue to deliver maximum impact while also keeping our team and partners safe. To help facilitate this shift, we developed a set of remote tools that were largely based on proven project examples and provided those to our teams and to use with the partners. This transition did not limit itself just to trainings only, but we also had to reinvent ourselves on how to conduct scoping and conduct user acceptance testing fully remotely. Training of trainers, the switch to remote group trainers, group training of end users and/or a remote training of trainers was definitely easier than conducting complete remote end user training. This is mainly because oftentimes this type of trainings will happen at the partner offices, and albeit it is in smaller groups. Some of the tools and strategies that we used, video conferencing, I think speaks for itself. The only thing that you want to make sure about is that the software or whatever tool you use can allow us to record the sessions. So Google Hangouts might not be your preferred way, your preferred tool, but Skype, MS Teams, Zoom would all do. Provide training materials and ideas for end user training. In the past, we obviously always prepared training material and training of training material, but with a remote training, you want to maybe go the extra mile. We had to provide our partners with more training resources than we would normally do. And it's important that the trainings are all well set up to provide good quality training. The third one, mobile-friendly website with application information, support guides, and training materials. We are seeing more and more projects where we're building websites for partners that have all the information that they might need and the information that might be useful to end users. This way, also end users can access a website that's publicly available and download certain training materials or other end user guides. Obviously, with developing these websites, it's always good to keep in mind that the end user might be using a mobile phone, so make the website user mobile friendly as well. Then on post-deployment support, in pre-COVID, we would support partners who have large-scale deployments in setting up the communication and operational structures for post-deployment support. We often would work with our partners to identify so-called application champions who show to exhibit an aptitude for mobile apps and smartphones during the training. And these people would then in turn function as a field support for the organization to their peers and provide support to other users in the area where people might be struggling with the technology. But because of COVID and the pandemic, organizations try to limit the in-person support as much as possible. And so we pioneered with some alternative strategies and found that WhatsApp was in fact very effective. The partner organization would create WhatsApp groups with their application champions and disseminate information to them and use that to provide a second line of support. And each champion would in turn have their own WhatsApp group with a subset of end users who would then who they provide support to. And this turned out to be very successful. The remote end user training, with the start of COVID, various partners and sometimes the donors asked to stop all the group activities for users, but still wanted to roll out their Concare applications. And before embarking on doing full remote end user training, it is important to ask yourself or your partner that you're working with certain questions to better understand their remote needs and to prepare themselves beforehand. This is obviously in addition to preparing the device beforehand, that the end user doesn't have to install the application themselves, for example. questions that we would ask is, and that you should ask yourself, is what is the literacy level of users? What percentage of users have a smartphone already? Do they have electricity at home? What's the access to mobile data networks in their homes, etc. The case study that I would like to talk about here in this presentation was on a project in Malawi. We had the Mobile Village Toolkit, which is an application that was developed to support health surveillance assistance in the healthcare data collection and other programmatic area decisions. This app was released across 8 districts in 2018 and had a total of 1,000 users. In 2020, we wanted to pilot the rollout of a second version of the application. So we contacted a select group of district users directly by phone and communicated that we would be providing direct one-on-one support and training to these HSAs and their supervisors, with the aim to learn mostly what kind of training material and training means they would need for further enhancements before we would adopting this as a proven approach and conduct offline training to the wider sets of users. We initiated some of the items mentioned here on the slide and further also refined our approach by updating the training and support module of the application itself and the setup of 2 different streams of WhatsApp communication channels again. So we would set up one direct to end user communication using WhatsApp for Business, and the other one would be WhatsApp groups again with the different application champions. I want to show you quickly on the next slide some of the findings that we found. So because of COVID, people had to stop using conducting home visits, and application usage came to a complete halt. And then after that, we saw an increase in the uptake again. The engagement that we found was really great of end users, and they were very open and welcome to the remote training approach. Users really appreciated having a support officer to reach out to when they were having issues through the WhatsApp channels. The form submissions to the HSAs that participate in the training increased significantly, and percentage of active users really increased by a long shot as well, and even went above the numbers that we saw pre-COVID. Some of the challenges and solutions I want to quickly talk about as the last slide. First of all, not every telecom operator in developing countries are always allowed to purchase data online. In the case of Malawi, our partner organization used to distribute data bundles for certain users via their district offices. And moving everyone over to one of the same telco that maybe did allow for online purchasing of data created additional challenges in our case, because some users didn't have the telco didn't operate in the area that they were working in, and so they would lack connectivity. So this additional challenge we overcame by users being okay, who had bad reception in their area. They would seek out a spot once a week where they would go to sync their devices. To connect with users for the first time, we use Skype. However, some phone numbers are not always able to be reached via Skype, and so we had to purchase a data bundle or airtime bundles to reach these people. On the third one, although the professional or business language in Malawi is English, the majority of the healthcare workers struggle to communicate in English. So thanks to using WhatsApp as a communication channel, we were able to do trainings and provide ad hoc and in-person support in Chichewa, which proved to be very effective. Also, the application was already was able to be in 2 languages, but it was never developed in 2 languages in the first place. Now, what we did in the version 2, or the updated version of version 2, we also had a support module in there where people could go to for frequently asked questions, and this was also now in the local language. The network connection was poor at times, and we used WhatsApp voice notes when phone network connections were too poor to communicate with users. So people might be struggling with something in the field. We tried to phone them, connection is bad. And it was actually the healthcare workers who started voice noting us in the first couple of times that we found this was a very effective way. Also, not every healthcare worker is always used to typing on smartphones all day, and the voice notes proved to be very effective in this way as well, instead of doing the written messages. Thanks, everyone.
Great. Thanks so much, Wouter. And I'm sure that just like those really solid notes, like, the WhatsApp voice notes. I mean, I'm sure that this is connecting with a lot of the folks in the audience and your experiences. And so actually, your experience, Wouter, I think that leads really nicely. I think that connects back into the assessments and just kind of understanding your audience, their context and needs. How do you kind of like leverage the technology available to adapt to that? And I think that's also kind of leads nicely into our last presentation from Caroline, as a similar process was used in Rwanda by Viamo. And also just, we have a lot of audience participation here. And again, I'm sure that some of these are ringing true for you, or maybe you've had different experiences. So please, send your observations and insights and whether this connects with you in the chat. And hopefully we'll have some time for Q&A at the end. So thank you in advance for that. And over to you, Caroline. Thank you.
Cool. Thank you. So yeah, I'm Caroline from Viamo, a relatively young company, 9 years young, but growing. Our mission in general is to connect organizations with digital technology to help them make better decisions. So you can see how training plays a key part in that. The training I'm going to dive into, we actually launched in 2019. So it's interesting because it was pre-COVID. So the need for it was very different. People were able to meet. But since then, in the last 2 years, you can see we've run a lot of training. So hopefully there's a lot of lessons we can kind of share here together. But I do want to take a moment to highlight the type of training I'm talking about. As alluded to, it's a little bit different. It's even more remote. Think about people that don't have access to the internet. This interactive voice response training is all done on basic mobile phones. If you can see on the left, we've got a photo of a user I visited recently in Uganda, a lady called Sarah. Now, I like to try and keep users at the front of mind when thinking about training. So in this case, she might not receive our training, but maybe the community health worker that we train comes to her and provides information. And on the right, you can see a guy called Isaac. Now, he had training to do with agriculture. So for me, when you're building these trainings, it's really nice to keep these users at the forefront when you're in person, but especially when they're remote, because they're not there with you and you need to think about how they're engaging. So just a little introduction to the type of training we're delivering here. There's no Zoom, there's no internet. We're really relying on kind of these basic connections. So that's a little bit of the background to this project. And yeah, we'll jump in. I can see Annika from Johnson & Johnson is here. So thanks. If you've got anything to add, please do, because this training was delivered with Johnson & Johnson and with the Ministry of Health in Rwanda. They came to us because they needed to reach a lot of people fast, and that was the need, rather than the fact we couldn't get to people in person. So with them, we created this kind of objective and a focus on behavior change, which really is at the core of why we deliver training. We want to see long-lasting impacts and people behaving differently based on what they learn. But in the short term, we want to make sure we can evaluate the lessons and the knowledge that we have kind of given to these people. So we run baseline surveys and end-line surveys, and then you can compare that to understand the knowledge change. And also we have questions at the end of each lesson, which we kind of present as a quiz, a scenario-based quiz, to see if people have understood the key takeaway of that specific lesson. So a little bit of background to the project and the reason it got launched. We then designed a curriculum. This curriculum, eight lessons, 5 minutes long, isn't standard. It can vary depending on what the partner needs, and we'll work with them. Often we do 1 lesson a week across 12 weeks. And this was just in 1 month. So people were having 2 lessons a week to get those 8 lessons in time. And underneath, you can see this is the process we have for kind of creating the training. We start by designing the content. We then try and optimize it for mobile. Remember, that's voice mobile. There's nothing visual involved. And then we'll test it. And then the mass communication is a kind of sensitization piece, which I'm going to dive into. It's really important to have successful training this way. And then the last step is analyzing the data and understanding the impact of what we delivered. So kind of hopefully that process helps you understand how we get the training live. Now, in this case, everything was done within 2 months, which is a great turnaround. So beginning to results, really, really kind of quick to launch, which was what the partners needed. So it was a real win for us. Now, before I dive into the results, there are some kind of there were some things in the favor of this project. We had really good partners, super engaged. Rwanda has pretty good network coverage compared to other countries we work in. Pretty stable country politically, things, are calm. People trust when they get messages from the government, they tend to pick them up. And willing participants, people wanted to have this content. The genocide is still very fresh, so people know that it's important. So there was a lot of good things that helped this training go really well. So I'll say that and then dive into the results. You can see here, yeah, great stats. So the first two on the left, the 94 and 93%, that means we reached over 48,000 trainees. Trainees, the learners, which in a month-long program, is very impressive and much more than could have been reached had this been done in person. And then you can see on the right, nearly half of the community health workers improved their end score. Now, there's a slight problem with how we measure this in that you never know how many people got the score right to begin with when you're looking at that change. So if you go to the 91% stat, 6 out of 7 lesson questions, 91% of trainees were getting the right answer. That's a very high score. So if people are already getting the answer right in the baseline, you're not going to see a huge jump in the end line. So it's something to bear in mind when you're trying to measure the training and understand the impact. The lesson we've learned from that is to try and use the baseline to inform the content that you're making. Don't train people on things they already know. So if you can use what you gather when you're doing that baseline, you can tailor the content to make sure you're really, when you finally reach these people who are hard to reach, you're giving them the stuff that's relevant. So yeah, some kind of takeaways from those results. And then as someone, I have a big background in product, very interested in the kind of these qualitative feedback as well. This is what we alluded to. There were huge reach in this project, getting people trained in a time frame that just wouldn't have been possible otherwise. So partners were really happy with this qualitative feedback, was really nice. And similarly, the trainees themselves liked it. They were happy to do the training on their mobile phones, and I'll explore why in a second. And they were happy to recommend it. So it was really nice that the wrap of this project was very positive. People took stuff on and enjoyed the experience, which is also important to keep people engaged with the training. They have to like it or they won't come back for lesson 3, 4, 5. You have to keep them engaged, which, as we've heard, is one of the challenges. So that was 2 years ago, 2019, we launched that training. So a bit ahead of the COVID curve of remote trainings. But what have we learned since? I've tried to kind of wrap these up into 4 pillars. Partnerships are really key. Strong MNO, so that's the telco relationships, for us really allowed scale. You need to make sure that technically you can reach the people with whichever platform you're using. You don't want to have bottlenecks or technical restraints that mean you can't get to them. And then for us in Rwanda, partnering with the Ministry of Health was key in providing credibility. They trusted the content. They knew, it was verified. If it had come from Viamo, it wouldn't have meant anything to them. So think about how you're presenting the training and who do you want that message to be coming from for people to really absorb it and trust it and listen. We've had projects where that hasn't happened. Actually, a project in Rwanda where creating the content took so long, nearly a year, that by the time it was signed off, it wasn't relevant anymore. It was COVID content and people didn't need to know about the symptoms of COVID anymore because a year into the pandemic, people knew. But maybe we at this point, we should rewrite the training and make it about vaccine awareness and reduce the hesitancy for vaccine uptake. So, having those good partnerships to keep to timeframes is super important in keeping the training relevant to when you need to launch it. And then piloting. With this, we did a small pilot, which was essential when kind of trying to reach 50,000 people. You need to trust the technology is set up the right way. Also, you need to trust the quality. There was a project that we ran and a translation was off and it became a negative instead of a positive. So instead of saying, don't wash your hands, that's not the message you want to say. So these pilots are really important as well for catching the quality and the detail of what you're releasing in your trainings. And then prepare. So this is the sensitization piece that I alluded to earlier. Really important that people understand what's about to happen. So we try and encourage half-day trainings or workshops with supervisors, or even with the trainees if you can reach them, so that they know what's going to happen. We try and get them to save the phone number that the messaging is going to come from so that they trust it again. Not all of us want to pick up calls from unknown numbers, right? It's a very human experience to not want that call. So we try and familiarize them that way. And then pre-SMSs, in this project, we sent an SMS the morning of the training to say your training will be coming this afternoon. And that means they can make sure their phone is charged, be in a place with good reception. And also the Ministry of Health did an SMS blast, which helped with credibility again. Now, there was a project we ran recently, and they did 3 waves of training, and the first 2 trainings didn't go so well. I think the stats were, it was 8% completion, which is incredibly low. And we insisted, by the time we did wave 3, we just said, we're not going to run this training if you don't do this sensitization, because people aren't going to pick up, they're not going to engage, they're not going to answer the quizzes. It's not worth our time or your money. Like, if you want to do the training, you have to invest in that sensitization to get people on board to complete it. So with that on board and with the kind of sensitization agreed to, we managed to up completion to 44%. So 8% to 44% is a huge, huge leap. And the only thing that changed was sensitization. So that's really something I advocate for, whatever or however you're doing that training. The preparation is really important, so people come and turn up and can be present and know what's coming up next. And then the last thing is post-training. What happens next? I heard Wouter mention WhatsApp channels. That's something we've tried to lean into. If people have WhatsApp channels, we try and share the audio files on there. We encourage discussion, but not all of the people we work with will have access to those channels. So we always do follow up with a post SMS that just has a key summary of that message. And it acts as a good reference point. We know actually feedback has been that people like to dial into the training for a refresher to hear it again. So sometimes people keep the training live on a hotline, and you can make an inbound call, and the trainee can listen to it whenever it suits them. So it's nice if they've got an SMS, they have this permanent physical reminder of the key takeaway from that lesson. So these 4 things that kind of, from all the trainings we've run, have proved themselves as fundamentals to developing good remote training. And in this context, it's IVR, but I think probably relevant across lots of different styles. So, and then, yeah, oh, sorry, did you need me to, these are just the last couple of quotes. The training being done anywhere, I had great feedback from a shopkeeper who was running a different training, and he loved that he could keep his shop open. He could do the training while still at work, which was really important for him. He didn't want to lose a day or 2 days or 3 days, having to travel for training. So that was really good. And as I mentioned, being able to replay so people can listen when they want has been something that we've had great feedback from. So both of these are from the Johnson & Johnson project in Rwanda. But yeah, I'll stop there, as I'm sure I'm close to time. That was a bit of a whistle-stop tour. So yeah, reach out if you want any more details, and happy to kind of share the learnings, because it's a fast-paced space with lots of change. So great to hear.
Great. Thanks so much, Caroline. And we're starting to get some great questions in the chat. I think that one that just came up, I think, Wouter and Caroline, you were talking a lot about the digital, engaging teams on WhatsApp, and, how to kind of control that. In person, we usually have caps of how many people should really be in a training at once. And so there's a question in the chat just about, how many trainees you can have in a WhatsApp group and how to manage that. So any insights on that?
Yeah, similar to normal training with end users, generally you want to limit the number of participants in the room. For us, we often use about say a maximum of 20 users per trainer. With WhatsApp, you have the communication is slightly more difficult, so I would say keep groups to a limit of about 20, and then what we did when we started scaling up in Malawi was having the 2 separate channels. So the one WhatsApp for Business, where you have one directional communication, and then the champions, which would have their own smaller groups with a subset of users, and they could provide more direct and personal support and explanations on the training. I hope that answers your question, but feel free to ask more about this one.
Great. Thanks, Wouter. And I think, just every organization and kind of context requires something, just to be sensitive to what your trainees need and how to best get the most out of your, out of the trainees and to get them engaged. I'm actually going to latch on, Caroline, to something that you were sharing at the end, and just this shopkeeper who is sharing, I love this because I don't need to, I can keep up my productivity. I don't need to leave my shop. I can do this on site. And there's a lot of cost efficiencies associated with distance learning. And I'm interested on how, I think especially Viamo and Dimagi, how you've navigated that, introducing distance learning or blended learning in areas where like in-person trainings with per diem and transport costs, where that kind of is deeply ingrained. So how have you navigated that? And also, Victoria, I'm interested too if you have any pearls of wisdom and the momentum guidance on that. Thanks.
Yeah, I'm happy to talk to that. We've had that feedback, like where's my per diem? And there's also the social side of it. People like to come together and see their peers who maybe, they work quite spread out across the district. If you're not seeing each other, that's an important time. So I think what you mentioned there about blending learning can really help. Like with IVR training, maybe you have a kickoff event, you have a launch event. So you get that one time to come together as peers. But beyond that, we've been kind of trialing with different trainings, having incentives. So if that's a bit of airtime once you've completed the training, I know there's another project we've run in Rwanda where once you've completed this online training, you get access to financial support. So it's like a criteria to like have access to something else. That had very good completion rates, understandably, because people really wanted to get to that kind of end goal. And similarly, certificates, very simple kind of, but effective. Normally when you go to an in-person training, you walk away with something, you have a certificate. So that's something we're trying to work with our partners as well to explore if we can create that experience. But yeah, the per diem challenge definitely gets mentioned, but I think with incentives, you can kind of combat it for sure.
I would agree. And I think that having the program be seen as an on-ramp to something else that's going to give the learners more mobility at the job, their career, kind of that's definitely one incentive. And I would also add with the certificates now more and more with digital programs, you can have digital credentials that, kind of follow you. And that's great, just like, a certificate to be able to have some sort of digital certification. So, you could put that badge on LinkedIn, you could put it on your email signature, and having that to show that, your achievement that you have from that training program or skill.
Thanks, Victoria. And, I think that recognition is important. And also, Caroline, kind of going back to your point, like we are still figuring out how to, we're social beings. We've learned that more than anything during COVID. And, like, how do we balance that? And, because it is motivational to have, those in-person communities. So, just again, looking forward to, like, this is the power of this community to help, share those experiences and how we can keep doing that better. There's a great question, actually. One of the big things about trainings, of course, is like, how are you following up? How are you how are you reinforcing concepts that are learned? And there's a nice question from the audience just about when pivoting from in-person to remote learning, have you found the demand for follow-up or refresher kind of post-training support has differed, or if that's changed, and suggestions on how to navigate that? So that was something that I think all of you kind of mentioned in your presentations. Looking forward to hearing from you. Maybe Walter, do you want to kick us off with some thoughts on that?
Yeah, sorry, can you just repeat the question one more time?
Sure. It's just about lessons learned from about the demand for follow-up and refresher trainings after the training has been completed. And just, do we have any approaches or strategies that have, just to make sure that we're doing that as effectively as possible, or any suggestions for effectively doing remote follow-up, refresher supports for recently trained users? That was a long question, but hope you got it.
Yeah, I got it. Thanks. And we didn't do any like follow-on refresher trainings, but we didn't really find the need for that. Through the mobile application usage statistics, we were able to see quite good uptake of people, and because they had this direct channel to their within their groups and with the peers and the champions, who we also stimulate to continue engagement with their peers. We didn't see the need for follow-on trainings. Once COVID started to slow down, we did do sort of like a in-person refresher trainings, and it was very interesting to see where people, often on the application side and end users, they were able to, we saw very good uptake, as I mentioned, but with regards at the district level, for example, where people were expected to be using the dashboards, and where it's more difficult to find user metrics on those, that's where we saw people didn't latch on as much. And so we had to do some refresher trainings on the dashboard at the district level.
Thanks, Walter. I know Caroline Viamo has some really nice experiences with the follow-up trainings. We are at we're like 1 minute past. I also there's some great questions now that are coming up in the chat, especially about incorporating gamification. I wish we could continue this conversation for another hour. But unfortunately, I think we do need to start wrapping up. But again, kind of, I think, Christina, like, let's figure out how we can continue, using the power of this community to keep this conversation going. And definitely, this is something where we're learning something new every week, just with every experience. Thank you all. Just a quick thank you again to all of our panelists. This is, again, an evolving field. So glad that we have excellent resources available, experiences, and also this global community. So thank you. And over to you, Christina, to wrap it up.
Great. Thank you so much, Sarah, Caroline, Julia, Walter, and Victoria for sharing your experiences and helping to continue this conversation. So I posted the link to how to sign up for the Global Digital Health Network listserv in the chat in case you ended up on this webinar with not through the listserv. That's a wonderful place to continue the conversation. We do encourage folks to ask questions and post questions like the ones that we got even in this webinar on the listserv, and you'll get lots of responses within a matter of 24 hours. So please do use the listserv. And of course, the Global Digital Health Forum is coming up. I'm sure there will be opportunities to continue this conversation then as well, as I know we have sessions on distance and blended learning at the forum. And we can explore other opportunities for continuing this conversation. So again, thank you to all our speakers. Special thank you to Abt Associates for hosting today. And we look forward to seeing you all in just a few weeks at the forum. Have a great rest of your day, everybody.
Thanks, all.
Thanks.
Bye.